sometimes be a confusing thing. You know what I'm talking about. That's why we've brought in an expert to help us figure things out. Katie Vettel is the medical biller from Red Door Pediatric Therapy. She's here to help us kind of find some of those answers. So good morning.
Good morning.
I think we assume, well, we've got insurance. Hand them my card, now I don't need to worry about it again.
Right.
But actually everybody's plan is different. The things that they cover, different. How they cover it, different.
Yep.
So why don't you kind of walk us through that? So you've got most insurance plans have a deductible, and what does that mean?
A deductible is kind of an accumulative amount that you have to pay before your insurance starts to pick up. It varies from plan to plan, but that is something where as you go in for visits, you will add up to that total amount, and then they start to pay.
Okay, but then you might say, well, but I've got a copay.
Yeah, and a lot of plans do. Those are usually for like office visits and whatnot. It's a set amount. It's a smaller amount than a deductible typically, and that's something you pay every time you go in. So it typically doesn't go away.
Okay, so you don't reach a certain point and you don't have to pay that anymore?
Some insurance plans might let that accumulate toward an out-of-pocket, but most you will always have that.
Okay, but what's the difference between the copay and the coinsurance?
So the coinsurance is a percentage that you pay after either the copay has been paid or after you have met your deductible.
Okay.
So,
but if I go to, like say I choose Red Door Pediatric Therapy, is it guaranteed that your insurance is going to pay for that?
Not necessarily. I mean, not all services are covered when it comes to pediatric therapy. Depending on the diagnosis, some insurance companies might not cover it. A lot of our kids come in for something that's called habilitative therapy, which is where we are just trying to catch them up with their peers.
Okay.
Some do come in for rehabilitative, which is after they've had like an accident or an injury. Most insurance companies are really great about covering rehabilitative, but we do run into issues where they might not cover habilitative.
Or maybe just a certain number and
Right.
then that's it, or something like that.
Yeah.
Okay, so what I'm hearing is that people need to find out about their own plans and ask the right questions.
Right.
So kind of walk people through the questions they need to ask, not just for this service, but for any service.
For any service. Well, first of all, you want to ask if the provider that you want to go to, if they are in network with your insurance. If you go with an in-network provider versus an out-of-network provider, you're always going to have a better benefit, usually possibly a lower deductible or just a copay. You want to ask if the services that you're going for are something that is covered, like speech therapy, in our case, speech therapy, occupational therapy, physical therapy, counseling. Is that something that's even covered on your plan? You want to see if, in our cases, if that habilitative care is covered. And then also check to see what your cost share is. So like your deductible, your copays, your coinsurance.
Okay. Well, most insurance plans pay for an evaluation so that people can find out what they need before they find out whether or not their insurance pays?
A lot of them will. I mean, that is something that you also want to ask when you go in or when you call your insurance, is just say, okay, we are thinking about going for this reason. We don't know exactly if that's what it is or not, and that's why we're doing the evaluation. Is that something that you guys will at least pay for? And most insurance companies are good about that, but it's still important to ask.
Okay, and when you go into wherever it is you're going, in this case, a Red Door Pediatric Therapy, would you ask, okay, so is there going to be something that typically is not covered? Are these questions that you can answer at your facility?
It can be tricky. I mean, at our facility, we do, once we have that evaluation set up, we will call the insurance companies and just ask to see if these services are covered. Obviously, we don't always know what we're going to be seeing the child for until we do that evaluation. But we can, if we find out the habilitative care is not covered, we can let the patient know right away. There might be cases where if we're out of network, it might not be covered at all. And that, again, is another question that you should be checking with the insurance company about. But
okay, so if you run into a case where it's not covered, how do you talk to people about whether or not this is something, sometimes I think the benefit of it outweighs the cost.
Right.
You see what I'm saying?
Yeah.
So how do you have that conversation?
Well, and we do have families that, they know they need to get their child in. In our case, and I'm sure in a lot of other clinic cases, they will offer, maybe some private pay options. they might require you to pay up front in order to come in for those services, but they can do that. Or sometimes you can work with case managers and they can, do that eval and then maybe give you some home programming, some ideas for you to work with at home with your child.
So the important thing is to A, ask questions.
Yep.
B, be honest about your situation, and then also work with the provider.
Yes, absolutely. Communication is key.
Okay.
It's great.
Tell people where to find you.
We are at 2625 North 19th Street in Bismarck, up by the Golf Dome. We're also in Minot, and we are opening an office in Grand Forks pretty soon.
All right. It sounds like people are in good hands when
yes.
they come to you. All right. Thank you so much for being here, Katie.
Absolutely. Thank you, Monica.
We will be back to wrap things up. Don't go away.